Measles media briefing. We'll be joined by Dr. Linda Bell, our state epidemiologist, who will provide you with an update on the measles outbreak in the upstate. Following her presentation, we'll take questions from reporters. We do have a hard stop today at 1:30 so that Dr. Bell can get to another meeting. So with that in mind, I'll turn things over to Dr. Bell so we can get started.
Casey, thank you so much, and good afternoon, everyone. On Tuesday, the South Carolina Department of Public Health reported 124 new cases of measles in the state since Friday. That brings the number of outbreak-related cases in South Carolina to 434. There are currently 409 people in quarantine and 17 in isolation, with the latest end of quarantine for those being February the 6th. In DPH's investigation of the new cases, a person with confirmed measles, we have learned, attended the South Carolina State Museum in Columbia while infectious. People who visited the museum between the hours of 1 p.m. and 5 p.m. on Friday, January the 2nd, may have been exposed. I'm going to stop here for just a second. I hear some background noise. People should be aware that the person did not know they were infectious at the time of the exposure. They were an upstate resident, and we still have not had any confirmed cases of measles in any region other than the upstate. South Blackstock Road. People who visited the store between the hours of 4 p.m. and 7:15 p.m. on Wednesday, January the 7th, may have been exposed. And this person did not know that they were infectious at the time they visited the store. The incubation period for measles is usually 7 to 14 days, but it can be up to 21 days. Therefore, people exposed at either of these locations who are not immune could begin developing early symptoms for measles now. So DPH is asking anyone who is at the State Museum or Bentheim Spartanburg during these specific days and times to contact a healthcare provider if you believe you may have been exposed and you develop symptoms. People who were exposed at the museum, especially those without immunity through vaccination or previous disease, should monitor for symptoms through January the 23rd. And those exposed at Bentheim should monitor for symptoms through January the 28th. If you do not have immunity to measles, consider getting vaccinated now. At least 30 additional locations of public exposures have been identified. And DPH is not listing every location unless the specifics of when the exposures may have occurred can also be provided to inform people. The settings of potential public exposures other than schools that have been newly identified in the last week includes churches, restaurants, businesses, and many healthcare settings. So the message to focus on here is not the names of the locations. It is that circulation of the measles virus is increasing in numerous community settings in the upstate, and the risk of infection to those who are not immune to measles by vaccination or previous disease is increasing. This includes people who may be traveling to the upstate region. So DPH strongly encourages those who are not protected to consider getting vaccinated now to protect against unexpected exposures, against illness and possible complications. While complications are not reportable to DPH, we have learned that 8 people have required hospitalization for complications of the disease. Some of these are adults and some are children. And additional cases required medical care for measles, but were not hospitalized. And to protect privacy, DPH does not provide protected health information or any information that could identify persons. And due to the exposure that have occurred in multiple healthcare settings, we remind anyone who needs medical care and knows or suspects that they may have measles that they must notify a healthcare provider before visiting a healthcare facility. And if they have one available, they should consider wearing a mask when seeking care to protect others in those settings from being exposed. We're also recommending that emergency departments and urgent care settings in the Spartanburg area provide masks as part of their measures to reduce exposures that are occurring in healthcare settings. We continue to emphasize that we need to increase measles, mumps, and rubella vaccination coverage to stop this outbreak. Of our 434 outbreak-related cases whose vaccination status is known, about 98% are unvaccinated. And while no vaccine offers 100% protection against the infection, the MMR vaccine is actually one of the most effective vaccines. And in preventing measles, it does a great job. It has been shown that it can provide lifelong protection for about 97% of those people who complete the recommended 2-dose series. These vaccines are available at many primary care providers' offices, at pharmacies, and at DPH health departments. DPH has also once again activated its mobile health unit to offer MMR vaccines today and tomorrow at the Unitarian Universalist Church in Spartanburg. People can get vaccinated at no cost from 11 a.m. to 3 p.m. today and tomorrow, and at the church that is located at 320 Wheeler Court in Spartanburg. So we continue to encourage everyone to take advantage of these opportunities to protect their health and to protect others and to stop this outbreak. And with that update, I will turn it over to questions.
Thank you, Dr. Bell. And if you don't mind raising your hand, we'll call on you in the order that you raise your hand in. As I mentioned earlier, we have a hard stop today at 1:30, so we'll take questions until then. And in light of that, we will remind folks, if you would please, if you have multiple questions, ask one at a time so that we can get through folks, and then you can raise your hand again if you have additional questions. So we'll start things off with Erica.
Hey, it's Erica Edwards with NBC News. Just to quickly clarify, and then my real question is coming. Do these new numbers reflect newly diagnosed cases, or is this surge because of a backlog from the holidays? And then my real question is, what are the specifics about why those 8 people have been hospitalized? What kind of treatment was required? Thank you.
These are newly diagnosed cases with onsets of illness within a recent time frame, so this is not a backlog of cases that reported from some delay over the holidays. And just as I said that complications are not reportable to us, we don't follow people through their course of illnesses, and we're aware of the general types of complications that can occur as a result of measles infections, but we don't have the specifics of those cases that were hospitalized.
Thank you, Dr. Bell. Danielle.
Hi, this is Danielle from WYFF4 in Greenville, South Carolina. First, I want to piggyback off of sort of what Erica said there. Can you speak to the symptoms that people should be looking for in the early stages of it? And then I also want to tag on there. People are wondering about boosters. Can you speak to when do I need a booster and how effective is that booster after I get it?
Okay, of course. The initial symptoms of measles include a runny nose, red, watery eyes, and a cough, a fever. Those early symptoms progress to a rash within about 2 to 4 days that starts on the face and then progresses over the rest of the body. And I should mention, while we don't have the details of specific cases, but the complications of measles that people need to be aware of are pneumonia, encephalitis or inflammation of the brain as a result of the virus, and febrile-associated seizures. The measles virus can affect the immune system in a way that makes it more likely to get other infectious diseases. So those are some of the things to comment on. And then as far as the vaccine, the measles vaccine is not one that requires booster doses. This is a vaccine that when people complete the initial 2-dose series starting at 12 months and then the second dose at 4 to 6 years of age, offers up to 97% of the people lifelong immunity. So booster doses are not indicated. That would be only in perhaps rare situations where somebody may be traveling to an area where ongoing exposure or ongoing transmission, and they're not aware of their vaccination status. And I would add that travel to the Spartanburg area now might be included in one of those areas of ongoing transmission.
Thank you, Dr. Bell. Tom?
Hi, Tom Corwin, Post and Courier. We are aware that there have been some cases related to travel either to South Carolina or from South Carolina that are in other states. And I know you were coordinating with the CDC on this. I know you don't want to give us individual details, but can you tell us how many states at this point you have notified about either a case here or a case that resulted from exposure here? Just in general terms, are we talking like a half dozen, a dozen or so?
Well, one of the things that we've done is we send a notification nationwide if someone may have been in a location like an airport where there could be many travelers from any state who has been exposed. So we're not providing a list of the specific states. That has been offered, but what I would remind you of is that if we have tourist attractions or any location where people may have come and visited from anywhere, in those instances, we'll just use the CDC notification system to alert all state health departments that if they identify people with suspect measles and they have a history of travel to this area, then to an area that's been identified as a potential public exposure site, then they should more strongly consider the diagnosis of measles in the early evaluation. And that's one of the reasons why we provide those national notifications of public exposures. If they're more local areas or places like Bentheim and Spartanburg, where others from other states are not likely to have visited, then we keep those notifications local, or if it's specific to travel between selected states. And that's how we make decisions about how widely or how narrowly notifications go.
Thank you.
Alyssa?
Hi, Alyssa Young with Spectrum News, South Carolina. So I know a while back, like towards the beginning, we talked about like not going through those, like you're not in the power to go through making the vaccination priority or mandatory. But one of our South Carolina senators, Josh Kimbrell, he wrote a letter to Spartanburg County School District 2 about revisiting their policy, making communicable diseases like measles and polio like a priority for schools, since it was such a big schools that was involved. What's your opinion on that?
Well, I would leave it to the school to respond to that specific correspondence, but DPH has provided our school entry requirements for vaccinations, and that information can be found on our website. And so that is, that follows our recommendations and our requirements.
And Kiki?
Hi, Kiki Gushu from WLTX in Columbia. My question kind of piggybacks a little bit. Can you talk a little bit about what the vaccination requirements are for school districts in South Carolina and what the exceptions are?
Well, the school entry requirements are very specific for different vaccines. So I refer you to our website. People can get a medical exemption if they have a medical reason that for which they should not receive a particular vaccine based on maybe a prior reaction or an underlying health condition, or people can get a religious exemption. Information about that can also be found on our website, or they can get a temporary exemption if they are in the process of getting caught up on their shots, or they're awaiting records if they've transferred from one school to another school and those immunization records are pending.
Emma?
Hi, Emma with WCBD News in Charleston. With the Columbia exposure, are you confident that it has spread to other parts of the state? And are you testing the wastewater in any other areas?
The exposure that occurred at the State Museum was a Spartanburg resident. So we have not identified new cases in the Midlands region who are residents of the Midlands region. But as I mentioned earlier, the increasing number of settings where we have identified public exposures that may be outside of the Spartanburg area is a concern that we may see cases in other areas. And if you don't mind, can you repeat your second question, please?
No problem. Are you testing the wastewater in the
Yes.
upstate and other areas?
Yes, we began testing for measles at selected wastewater treatment facilities back in November. And most of the wastewater treatment facilities that are testing are focused in the Spartanburg area, but we do have selected wastewater treatment facilities that are testing in other areas of the state. That would give us the ability as a sort of an early detection system before people may seek medical care and get tested. What that testing tells us, though, is that it detects the virus in wastewater. It doesn't tell us how many cases there might be when there's a positive signal. It doesn't tell us if that's somebody that's just passing through the area. And so the information that it gives us, unless there is a sustained positive signal, is somewhat limited, but it is an early and additional very beneficial surveillance system that can give us a picture of where measles may be being circulated that has previously been undetected if people have not yet sought medical care.
Thank you, Dr. Bell. And this question is kind of similar to a question that was asked, so I'm reading it from the chat. How likely is it that measles will spread in Columbia?
That depends a lot on the vaccination coverage, person by person, and also at the population level. We see an area of concern in Spartanburg because, as compared to other areas of the state, there are pockets of communities in the Spartanburg area that have lower than what is beneficial vaccination coverage. Other areas of the state have higher vaccination coverage, but we know that there are a number of people out there who are not protected against measles. And so the likelihood with these public exposures, especially with cases being identified in other areas of the state, is quite high that that virus is going to find anybody who is not immune to measles. And so we do anticipate that we may begin seeing cases outside of the Spartanburg area because of the high number of cases that have been reported recently.
Thank you, Dr. Bell. And there's one more question that's been in the chat for a minute from Teddy Rosenbluth from the New York Times. She asks, can you speak to why you believe there's been such an uptick in cases recently?
Yes, well, we know that a lot of these cases are the result of activities over the holidays. We had more travel, more family gatherings. School was out and people were out and about in the community and may not have known that they were infectious. So we're attributing the increased number of cases to those kinds of activities around the holidays. We're also seeing ongoing transmission in households where, entire households of people who are unvaccinated are being infected. The school closures during the holidays inhibited our ability to get contact information for other children who may have been exposed in the schools just prior to the holidays. So our inability to get that information and notify those families resulted in some people being out and about in the community without knowing that they were infectious. And all of those things are contributing to the increased number of cases. And around each one of those new cases, we are, we have an increasing number of contacts, and we anticipate seeing more and more cases among those susceptible contacts. So this is a fallout of all of those factors.
Thank you, Dr. Bell. And Ann Thompson.
Hi, Dr. Bell. I apologize. This is Ann Thompson from NBC News. I know that the vaccination rate for the state of South Carolina, at least the latest CDC numbers, is 91.2% for the upstate area and Spartanburg in particular. What is the vaccination rate there, and how much longer do you expect this to go on? Are you looking at weeks, months? What do you anticipate? Thank you.
Yes, I think what we're seeing that in Spartanburg County as a whole, while they may have a vaccination coverage level, and we may need to get this number back to you, but I believe it is a little bit below 90% overall. The concern is that these pockets within even the Spartanburg County area, for example, there are schools that have vaccination coverage that is as low as 20%. In some particular school settings. So as we look at the risk of school transmission, that's a concern from one location to the next, especially if you have a congregate population in a school. and the vaccination coverage there is lower than the surrounding county, that's a concern. So in selected schools, vaccination coverage is lower. And in certain pockets of communities, we may see more intense transmission because the vaccination coverage there. So it's important to look at herd immunity overall. It's important to look at our statewide coverage. But as this what's going on in Spartanburg County now is the best example of, is that even small pockets of undervaccinated people can result in widespread transmission for this highly infectious virus, finding, every susceptible person in a population, regardless of what the overall vaccination coverage is.
And I'm sorry, did you say that the vaccination coverage in some schools is as low as 20%? Did I hear that correctly?
That's correct, that in some schools, there are the number of children who have met the school entry requirements is as low as 20%.
Thank you, Dr. Bell. Natisha?
Hi, Natisha Lance from WBTV out of Charlotte. You mentioned that the vaccine is for lifelong effectiveness. Are there any instances where the antibodies could be wiped out from someone's system? And if antibodies are wiped out or people are concerned that they have not been immune, how can they be tested? Can they go to a pharmacy or would they have to go to their doctor?
Well, I wouldn't say that in any way that immune systems are wiped out. What it is that some people just don't mount an immune response to a particular vaccine. And while about 97% of the people who get both doses do respond, there's still a small number of people whose immune systems just do not respond entirely. So they may still get a breakthrough infection that could be not as serious as if they were unvaccinated. And we do not recommend, though, that people go out and get antibody tested just routinely to see if they're immune. Now, there may be circumstances where somebody might need to return to a work site or return to school. And then there are selected opportunities where somebody could choose to be tested for their immunity to determine whether or not they're immune or whether or not they've responded to the vaccine. That, however, is not generally recommended because the vaccine is so effective for the vast majority of people who get it.
What about someone who's had cancer, maybe chemotherapy? Would that cause the vaccine to be ineffective?
Yes, potentially. So people who have underlying health problems that might compromise their immune system is one of the reasons why people might not mount as strong of a response that offers them complete protection. And so a compromised immune system as the result of medications or underlying health conditions could be a reason. But for the most part, when children are vaccinated at a very young age, you're not generally seeing these underlying health problems. And so we're getting that great immunity early in life to protect them throughout the lifespan.
Thank you, Dr. Bell. And just as a reminder, we have a hard stop at 1:30, so we're trying to make our way through these questions. So if you don't mind just asking one question at a time. Next question, Aaron.
Hello, can you hear me?
Yes.
I just wanted to know real quick, when are the next times for vaccine clinics coming to Spartanburg County? Is that something that representative officials, school districts need to set up, or is that something that the health department will be setting up?
Well, community partners or anybody who desires to have one of our mobile health units come can do that through submitting a request through our website. But those that we have set up now have been announced, and I just included that in my briefing earlier. So those are the ones that have been scheduled as of now for today and tomorrow.
Thanks, Dr. Bell. Tom?
Hey, Dr. Bell. So one of the reasons we have herd immunity is, or try to achieve herd immunity, is to protect those people who can't be vaccinated or for whom the vaccination won't work. So if you're one of those people, for whatever reason, and you're in the Spartanburg area or even just in the upstate, what would be your advice to those folks as far as precautions or things that they should do to help limit that exposure?
Yeah, that is a great question. And we would advise people who may find themselves under those circumstances to consult with their healthcare provider, who could advise them based on whatever their underlying conditions are, what concerns are, what their risk factors are, depending on what their activities are in the community. They should consult with their healthcare provider.
Thank you.
Erica?
Hey, where are you focusing your resources right now to stop the outbreak? Just briefly.
We're focusing our resources in the upstate area on case and contact investigations to respond as rapidly as we can to suspect and confirm measles cases that are reported to us so that we can advise people who have been confirmed, if they're infectious, what they need to do to stop the spread to others, and ask them to help us identify who their other close contacts might be and where they've been in the community. So we are focusing all of our efforts on containing the spread of the virus around that surveillance information that's reported to us.
Thank you, Dr. Bell. And Baker?
Yes, Baker Malsby with Spartanburg Herald Journal. You all have been at this thing now since early October, and I think it's beginning to become pretty well known what group or groups in Spartanburg County are, at the center of the outbreak. I hope this is kind of an okay way to ask it. I mean, is frustration seeping in at all? And can you describe the nature of the resistance you all are seeing to vaccinations? We know this is not just kind of an across the board general population issue, but that there are certain groups that, just are not getting vaccinated. And I wonder if the tactics for reaching them have changed as this thing is dramatically kind of exploded, or again, if there's frustration with not being able to get through to folks.
Well, we're continuing to work with community partners and trusted leaders in these communities to help us convey the information about how people can be protected. It is disappointing to have these excellent tools that are available to us through vaccination, through disease control measures that people are not fully taking advantage of. So I would say, this is a disappointment to see these now hundreds of cases that the majority of them could have been prevented, and we have an opportunity to prevent further cases if people can adopt these available tools and help us stop this outbreak sooner rather than later.
Thank you, Dr. Bell. And Liz?
Yes, sorry, I couldn't find my mic. Liz Neprin from ABC News. I was curious if you are getting through at all to some of those groups, if you are seeing some of that resistance fall away, and if there is an increase uptake in vaccinations since the outbreak started.
We have seen an increase in the uptake in the vaccine since the outbreak started in the Spartanburg area, and we saw a more marked increase earlier in the outbreak than what we've seen now. So we hope that uptake will increase. We'll continue to monitor that month by month. We are really grateful for the cooperation that we have received so far. We appreciate the cooperation that we've received from schools and making sure that children who could be infectious are not infecting others, and other community partners. So those are the things that we hope that we'll continue with.
Thank you. And we're almost at 1:30. I don't know if we have time for one more question. Dr. Bell?
Yes, we can go ahead and take one or two more questions, please.
All right. Jen?
Thanks, Dr. Bell, for doing this. I'm Jen Kalfas from the Wall Street Journal. Can you just walk me through how the health department is monitoring those in quarantine? Some 400 people now. Have there been instances of these quarantines not being followed? And if so, are there any penalties for that? Just curious how that's all working.
Yeah, when we identify people who have been exposed that we can directly communicate with, we provide guidance to them about the measures that they should take by staying home for the 21 days after the last exposure. And we ask them to report to us whether or not they develop symptoms throughout that quarantine period. We have, we're working on an electronic system where people could just text us and say, I'm feeling well today, or, they may have developed some of the early symptoms that I've mentioned. If we don't hear from people on a regular basis, then we have our frontline case investigators who reach out to them to see how they're doing and whether or not they're experiencing any symptoms, especially in these households where we know that transmission can continue to occur. And we do appreciate, for the most part, we have had cooperation with our guidance to stay in quarantine. As expected, though, we could not get 100% cooperation, and we follow up with families if we learn that they may have not followed our guidance, may have been out in the community or something like that, reminding them of the importance of observing quarantine and protecting others in the community. And that's a summary of how we're working with those in quarantine.
Thank you, Dr. Bell. And apologies, everyone. I think we're running out of time here. So if you have questions that we weren't able to get to, you are welcome to send them to our media mailbox at media@dph.sc.gov, and we'll follow up with you as soon as possible. Dr. Bell, thank you for your time, and thank you, everyone, for attending.
Yes, thank you, everyone.